In this video, we're going to be discussing DIY ballistics gel for ultrasound training. We're going to share with you materials and details on how to make your own. We're going to share with you some insider tricks for success and how to avoid mistakes. We don't have necessarily anything to disclose. We just want to make this information free to anyone who might find it useful. There doesn't seem to be any question that there is a tremendous need for simulation out there. It's terrific for bridging the gap between didactic education and real patient techniques. It unquestionably helps build confidence, and it helps build crucial techniques for both scanning and needle placement under the beam. The question is, how can I get all of these things without spending a fortune? Achieving ultrasound simulation success can be as easy as simply purchasing a commercially available product. The advantages are they come in pretty packaging, and often they have realistic structures like nerves and blood vessels that you can see under ultrasound. And full disclosure, they do have slightly better durability than that which you can create in your own kitchen. But they also come with considerable disadvantages. They come at a huge expense. It's not uncommon that a small simulator that's used for ultrasound can cost as little as $125 and as much as nearly $1,000. They all come with wearable parts that need frequent replacement, and depending on who you order from, you'll be completely dependent on a third party to ship and process orders in a timely fashion. In today's day and age, that becomes a big problem. Homemade ballistic gel models come with a tremendous amount of advantages. They're incredibly cost-effective. They're completely reusable after you've scarred them up from use under ultrasound. And they're completely customizable. So if you're teaching a class or participating in a course, you can simply make it any way that the course would require it. You can also add layering or vessel or nerve target implantation. And this is all done essentially with one upfront cost. This will last a long time through the process that we explained to you in this video. And there's a mild disadvantage that comes to it as well. Again, full disclosure, you're not going to get the same durability out of that which you make out of your own kitchen versus some of the commercially available products. Here's an overview of what you're going to need. You're going to need some ballistics gel, about 10%, which we'll discuss on the next slide. You're going to need 4 or 5 discount bread loaf pans, which we're going to call mold pans. You're also going to need 2 or 3 glass or tempered loaf pans, which we will call heating pans. You're going to need some 2 or 3 silicone tubings in different sizes, which you're going to use per different mold pan. You could also use 2 different sizes of metal dowel rods that are cut at least 2 inches longer than the loaf of bread pan. You're going to need your kitchen oven, and you're going to need some regular old boring cooking spray. You're going to need a power drill and some rough sandpaper. And you're going to need a metal drill bit in 2 different sizes, slightly larger than the silicone tubings or metal dowel rods that you've selected. There are several different kinds of ballistics gel. The ballistics gel is named in terms of its density or its weight. Now, stopping a bullet is different than ultrasound needle placement. So what's the difference between 10% ballistics gel versus, say, 20% ballistics gel? The weight or gel density refers to the ratio of gelatin to water inside that brick of ballistics gel that you've purchased. For example, a 10% solution is essentially 1 part gelatin to 9 parts water. This makes it a lot easier to work with, and it makes it more realistic when you're feeling it, pushing it, or placing a needle through it under the ultrasound beam. A 20% solution then represents 2 parts gelatin to 8 parts water. This makes it a lot more durable, but too hard to really penetrate with any kind of lifelike ease. So when you're working with a 20% solution in ballistics gel, the needle does not flow through the gelatin much like it would through an actual patient. Here's a secret when you're purchasing your ballistics gel. Try to buy what's called imperfect gel if it's available. Check out clearballistics.com. That's where we buy ours. The site was accessed on October 13th, and as of that time in recording, a large brick of this will only cost you about $80. This represents about a 90% savings if you were to buy one single simulator that was commercially available. After purchasing your gel, it will come to your home as a large block, or if you were lucky enough to get some imperfect gel, some smaller remnants, such as ripped up pieces of other projects. Begin by cutting the block into smaller pieces and place them into the glass baking pans. It's important that you do not place cooking spray into these baking pans. As indicated on the previous slides, you're going to need some regular old boring cooking spray. Make sure that it's non-stick, it's not flavored or colored in any way. Make sure that you wipe off your excess cooking spray from your mold pan. Again, this is not going into your baking or glass pan to melt the ballistics gel. This is simply to help assist having the molten ballistics gel slide out of your mold pans when it's done setting up. Making sure you're ready to pour the molten ballistics gel into the mold pans is essential. Make sure that the all-purpose cooking spray that is neither flavored nor colored completely covers any part of the mold pan that the ballistics gel is going to touch. Again, it's imperative that you do not spray cooking spray into your baking pans, only the mold pans. Now there's several right ways of doing this, but the way that we do this is we drill 2 different size holes in the pan, slightly larger than the silicone catheters or metal dowel rods that you're going to select. Then you're going to have to sand and smooth those rough edges. Place the dowels or your silicone tubes through the holes to ensure proper fit, and then just simply tie them off. Deanna has tried a variety of ways to get this accomplished. The way that has been most consistently beneficial to our training center is to use old Foley catheters that are expired or possibly contaminated from the hospital. Tie the Foley catheter off at one end and then just simply draw it all the way through the mold pan to the other side. You can also use metal dowels if you care to. Just make sure that the mold pan is nice and sanded smooth so it doesn't leave any rough edges, and that the dowels completely fill the holes. An incredibly important piece for success is to set your oven to only 250 degrees. Plan to take your time during this period and only allow about 2 hours of baking time. You honestly can't rush this. A high temperature in the oven will result in the air bubbles erupting and making a terrible and stinky mess inside your oven. Here's the secret for success. Heat your ballistics gel in glass loaf pans. These are the same tempered glass that you would use for baking bread. These glass loaf pans do not need to have cooking spray. You can simply add your ballistics gel, no matter what it looks like, and drop it right into these glass pans. These glass pans clean up much, much easier than the metal mold pans. Here's some heating tips. Your molten ballistics gel will be ready to pour from your glass pour or bake pans into your mold pans when the bubbles have completely disappeared from the surface and from the bulk of the gel. You can see in the photo that on the left-hand side, the glass pan is completely ready to go because there are no bubbles that can be seen on it. This varies greatly from the two glass pans that were probably put in the oven at a later period and are clearly not ready yet. You need to plan for about 2 to 3 hours at a slow 250-degree bake. Do not heat your gel at temperatures higher than 250. If you do, the gel tends to boil and will spill into the oven. So, a pro tip, line the oven with tin foil before heating your gel. Here's another tip we found very helpful. Make sure that your workspace is ready by cleaning it up and removing unnecessary items from your countertops or your pour area while your ballistics gel is in the oven. Make sure there's a clear path from the oven to your pour area and be certain that children and pets don't get in the way while you're bringing your ballistics gel that's 250 degrees and very sticky from the oven to your pour area. Your molds should be ready to receive their ballistics gel payload by making sure that they've had some cooking spray added to them. You can also use silicone utensils to aid in removing all of the residual molten gel from those baking pans. Now it's time to move your 250-degree, completely bubble-free ballistics gel from its prepared loaf pan into the mold pan. You can use a silicone spatula to help remove any of the remnants that are stuck to the glass and help it move safely into the mold pan. Use slow and purposeful movements. This will help minimize the trapping of air while you're pouring your molten substance from the glass into the mold pan. And remember, the gel is thick, hot, and sticky. Be careful not to splash and burn yourself. You may find that after you've poured your hot ballistics gel from the glass pan into the mold pan, that some bubbles or debris are found on the very top surface. You can use a toothpick or a skewer to remove some of these air bubbles or any of the surface debris that sometimes gets collected on the top. The bubbles will continue to float if the gel is still hot enough to be molten. The top bubbles can be raked to one side and then removed or simply popped with the skewer. Now comes the easy part, letting it cool. You can let your new model cool at room temperature for a few hours. When it's cool, it will be firm to the touch and will slide easily out of the mold pan. One of the things Deanna's discovered by making these multiple times in our own kitchen is that after cooling, you can simply remove any of these target columns that you've created with your dowels or surgical tubing. This will create a hollow column that can then be filled with water later. You can plug these holes several different ways, which we'll discuss in the next couple of slides. The dowels or the silicone tubes will come out easily, as you can see next. Here's a couple other great tips for you. After cooling, the gel mold should be easily removed from the baking pan. This is the reason why the mold pan needs to be coated with cooking spray. You can choose to leave it inside this loaf pan if you're going to transport it great distances. Your gel mold is ready for plug insertion and for water filling. Here's another pro tip that Deanna's found over the course of years of making these in our own kitchen. You can simply add a plug to one of the ends of the water column and then fill it with a syringe or a small jet of water. Simple tap water works just fine. You don't need to add anything to it to make it very lifelike as far as vessel identification goes. When it's full, completely filled and overflowing, then place the plug into the end and contain the water column. Make sure that there's no air inside the water column, as air is essentially the enemy of ultrasound and will disrupt your image. If you're going to transport it, I suggest you transport it while it's dry and add water while you're on site. Here's a couple of pro tips. Store-bought silicone craft plugs work really well to keep water inside a water column that you've created in the kitchen. Use caution when you insert them, as if you insert them too aggressively, this will lead to complete submersion of the plug into the gel and will make it very difficult for you to retrieve them later. Also, IV end locks work well to allow one to insert water multiple times or to extract water when you're done. You can simply remove these when you're finished. And remember, do not melt the Ballistics gel model with these IV end locks in place. Remove them before they go back into the oven. One of the things that Deanna's found that's worked really well for us at the training center is that expired one-way IV valves work really well to allow for multiple water injections into a single simulator. It also allows for refilling of the columns. I would use caution when you insert these as to not rip the gel mold. And again, don't add too much water and be sure that your water columns are free of air before you attempt to use ultrasound on them. Here's another couple tips that Deanna has found important over time making these in our own kitchen. These simulators tend to work great for a few days, from scanning and needle placement for a few hours on each day. Scars will form during use and are certainly made worse by bad technique, especially removing the needle at a different angle for which it was inserted. Large needles are really easy to see underneath the ultrasound beam, but also leave large scars. When scars become too numerous to continue the use of this particular simulator, it's time to melt it down and make another one. Lastly, if you're traveling with your simulator, make sure that you put it in your checked bag. TSA may question your model and what you're doing with it. When you're ready to take your gel making molds to the next level, you can consider adding a little bit of color. This accomplishes several important elements. One, it does not allow the learner to cheat as they're looking at the needle through a clear medium. Two, it adds a more lifelike, realistic feel and simulation to the learning process. You can add color in any skin cone, and this can be done at the beginning by creating a very thin layer that is not mixed into the entire mold. Once your simulator that has a thin layer of color on it has seen its last days, simply cut it off and then remold it into another skin layer. Do not make the mistake of mixing it into your entire clear ballistics gel mold. Over time, Deanna's found out a very ingenious way of creating very lifelike layers for things like tap simulators. This is done through a simple process of individual thin gel pores that are separated by parchment paper. Your first step is to cut a parchment paper that will overlap and create a tail in which that you can pull from one side after your gel has already cooled. We typically use about 2 centimeters of pan volume for each layer. We tend to use about 2.5 centimeters for the middle layer, which will simulate the internal oblique, which in most people tends to be slightly larger than the external oblique or the transverse abdominis. So here's an overview on how to create a layering effect. First, set out one of your loaf pans or mold pans that's already been treated with non-colored, non-flavored cooking spray. Fill the very first layer of the pan and then let it cool. Then cut your parchment paper large on one end to create a tail, allowing you to pull the parchment paper out after the next layer has cooled. Then pour your second layer onto the parchment, slightly larger than the first, and again, let it cool completely. Last, place your last parchment layer long on one end, just as before. Pour your last layer and let it cool. When all the layers have cooled, you can then remove the model from the pan. The long ends of the parchment paper, which create a tail, should be easily removed without ripping them. The layers will fit together perfectly and provide visible layers just like that of the external, internal, and transverse muscles. Any non-adhering areas are then just simply filled with ultrasound gel. We hope you found this video useful. Visit us at twinoaksanesthesia.com for more free resources or to register for an ultrasound course. Thanks again for watching.